We became really worried about an emerging theme, and until we drilled down in it, it wasn't necessarily emerging about the numbers of young people that were, and children, very young children, that were presenting at the GP, asking for a referral into the CAMS service. We also had a series of very, very tragic events relating to young people around suicidal ideation and self-harm. And I went to Mary and said, okay, the vision for us in East Renfrewshire is the same vision in Children First. What can we do together?
And our hypothesis was they're not necessarily children that have a mental health problem. They are emotionally distressed children for really good and understandable reasons. And what we needed to do was understand more about what was driving that and try and build an approach that changed that for children. So it sounds, I think, we're 5 years on, but actually this was a really radical new approach.
I'm here because I want to work on my mental health, but I don't have to constantly be thinking about that because it's not just like a one-on-one thing. I know if that's something was worrying me, then I could talk to you or Mel about it, but I don't have to constantly be thinking about that like I would in a one-on-one session. I could just talk to the other girls as if they're like my friends. Here I get to talk to girls that are my age and I can talk to them about whatever. I don't have to worry, because sometimes if I open up to someone then it makes me feel really vulnerable and I feel like I've lost all control of myself. But when I talk to people here, I don't have to worry about that. It's the kind of thing that it has like no pressures or anything, and like it happens over time, and I like that because it's like get to build trust with all the people in the group.
We'd gone to the GP based on concerns for our boy, who was probably about 9 at the time, and he was becoming quite withdrawn. He'd lost his sparkle. He was displaying a flash temper periodically, and generally his mood and demeanour had changed. And we knew that he was having a really hard time at school, but it was having a significant impact on his general demeanour and his self-esteem. And the doctor had referred us to Children's First, which we had never heard about.
The main aspects that Children First look at is, rather than just looking at the patient that we refer, they look at the whole family. They take a holistic approach, and they recognise that if a child has mental health issues that may relate to problems that are going on in the family, but the problem the child will have a significant impact on the family as well. So Children First look at the family as a whole and are able to give either the child or the family the appropriate tools to support them and achieve a good outcome for their mental health.
What she did was she met with me initially and my husband, and herself to our boy, who was fairly anxious but at the same time had a lot to get off his chest. She focused in on relaxation, on mindfulness, and spent a lot of time just finding out what made him tick, talking about his self-esteem and just trying to build his confidence up. It was very positive from the outset.
We would have had 650 more children waiting for a service in CAMS that may well not have been appropriate or not been timely at the time that they need. We have seen very few children that have been seen by Children First ever gone back into CAMS.
He's 4th year and had gone from 2nd year, I'm leaving school, 3rd year, I'm leaving school, I'm not going back again, I'm never going back again, to he's doing all of his exams this year. And yeah, and we still use a lot of the phrases, nothing lasts forever, this feeling will pass, this feeling won't last forever, and there's a lot of catchphrases, and so there's lots of little things that are good for him to be able to talk about that he can pull on and then it grounds him again. But I think that would be the legacy. He's learned to be grounded. He still needs a lot of help and support, but we certainly have the vocabulary to do that, and we didn't have the vocabulary to do it before.
It's about empowering families, building on their strengths, and a sustainable model where they give them strategies that then they can apply to all aspects of their life. And obviously that then has a massive impact on their education, because they then come into school in a place where they're more ready to learn and able to cope with school life.
I think all children and families should have access to this service nationally, so that they can all receive the level of support that they need for more complex psychological problems that aren't severe enough to be dealt with by the children and adolescent mental health services.
This is a brilliant example of rights-based work that delivers the promise for children who are distressed and in need of support, of co-production, of partnership work and restorative practice that gives control and power to children and their families and offers them relationships, not services.
So yeah, there weren't any other services. We wouldn't have known where else to go. And since then I've recommended Children's First and told friends to go to the doctor and to request a referral into your service, simply because of the experience that we've had.